Okay guys, so let's talk about a really important part of the body, your lower back. Now, 80% of people within their lifetime end up with low back pain. Okay, it's one of the most common, if not the most common reason for a doctor's visit. So this is a really important area, and as a chiropractor, this is a type of problem that I see constantly, lower back pain. So if you're in this section, the chances are you're struggling with some lower back pain. I would strongly advise an assessment from a movement professional, amplified athlete doc, someone who's qualified to really understand the nature of your problem. This video here, I'm going to talk about a couple of different things you can do to assess the stability or the motor control ability of your lower back, okay? So as far as this drill here, there should be no pain. All right, so we're looking for your ability to do these drills with no pain. We're also looking for your ability to do these drills maintaining a stable low back. Obviously, right? So the first one we're going to do is just a simple hip hinge, okay? So what we're going to do is we're going to start, and I suggest videotaping yourself doing this so you can really assess your movement. So we're looking at your hip hinge. Now, a word of caution as well, when you're looking at lumbar stability, you better have good mobile hips and a good mobile thoracic spine, okay? A lot of times for lack of mobility in your thoracic spine, the low back will pick up that sloppiness. Okay, lack of hip mobility, that's probably the most common. You're missing some internal external rotation, flexion, extension of your hip. Your low back is going to pick up that slack, okay? And that's why you see a lot of lumbar instability cases. Your lumbar spine is a crossroads for all kinds of muscles, hip flexors, your glutes, your lower back elements, your core, your pelvic floor, etc. So there could be 1,000 things wrong with your low back. This is just very, very simple assessments that you can do to really just see the motor control and the strength of your low back. Number one, hip hinge. This is a must. Feet shoulder width apart. Send your hips backwards. Okay? Keeping your knees relatively straight. Raising your arms. If you can maintain a nice stable lumbar position, okay, and you can hold this for a minute, chances are your lumbar stability is pretty good and your motor control is really good. Here's the common problem that I see. All right, you see the roundness of my low back, okay? Also, if you can't get your arms upwards in line with your ears, you're probably lacking thoracic mobility, okay? But if you can't maintain this position or you have low back pain when you're trying to do a hip hinge, okay, you probably have some lumbar stability issues, or maybe some hip mobility or thoracic mobility issues. Number two, okay, you get in this 90-90 position. What I want you to do, flex your cervical spine and get your scapula, your chicken wings off the ground. Hold this position. Now guess what, guys? If you can't hold this for 3 minutes without getting back pain or getting fatigue through your core, you might have lumbar spine instability issues. Women, 2 to 2.5 minutes, okay? Right in this flexion position. The other one is we want to test extension too. So the flexion, if that causes pain, you might have a disc issue. You might have some sort of lumbar irritation. This one here, the joints in the posterior aspect of your spine called your facet joints. If you have compression of those joints or any sort of stenosis, this is going to cause a problem. Okay, arms beside your body. And what you're going to do is you're going to go up very slightly. It doesn't have to be, you're not overextending. You're just trying to lift your chest off the ground, get your legs off the ground. Okay, you should feel this in your glutes and your lower back. Okay, once again, guys, you need to be able to hold this position for 3 minutes without any back pain, okay, and without failure. For women, 2 to 2.5 minutes. Okay, got it.